You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest says no more dentures. Get a fixed set of teeth or a permanent set of teeth in just a few appointments. With us, we have an expert on the topic, periodontist Dr. Denemark. Dr. Denemark, welcome to the program.
Hi, Randy.
I got that right? Dr. Denemark?
Yes, you did.
Okay, good. Now, before we get into today's topic, as a periodontist, what do you spend your day doing? Who's the typical patient?
Well, typically, I'll see a patient that comes in with a missing tooth or a fractured tooth, and they want it replaced with a dental implant. Or we may have someone that has old dentistry and they're missing several teeth, and we'll need to treatment plan them for, again, dental implants.
All right.
So what we're concerned with is the supporting structures around teeth or for dental implants. That type of thing.
So you're a periodontist.
Yes.
You're the specialist on the gums.
Yes.
Elaborate on that. So after dental school.
Yes. Yes, I was a general dentist for quite some time and then decided to go back to school. Spent 3 more years of my time educating myself and being a periodontist. And essentially what a periodontist is someone who looks at the support structures to teeth.
So, we started the show where I said no more dentures. Is that the future of dentistry?
Yeah,
you think?
I think some people, Carl Misch even, had said that it's malpractice to not even diagnose a treatment plan with using implants. To give someone dentures is kind of an end road, passe type of treatment. You're condemning them to a lifetime of dealing with things that you and I wouldn't understand completely. Plastic teeth, they look like teeth. They don't feel anything like the teeth, and they don't function like teeth.
So most of the time they are candidates for dental implants.
Absolutely. Yeah, there's very few things that preclude someone from having dental implants. It's not a real difficult thing to accomplish. It's very predictable nowadays. The technology has come so far, so fast, and recently we just have such a high level of predictability. So let me tell you about this patient that came in.
Okay.
She actually was very, very timid and quiet at first, and I was trying to get some information from her, and she said, "Stop there, right there, Dr. Denemark. I want to make sure you understand. I cannot let my husband know about these dentures and these implants." I said, "Why?" Well, I like to have the spouse as supportive in that. She said, "He doesn't know I have dentures."
Wow. Okay.
I said, "How long have you been married?" She said, 35 years. I said, "And he doesn't know that you have dentures?"
Is that right?
I said, and this is a prime example of how patients are so
embarrassed.
This was the point of shame. She didn't want her spouse, her life partner.
Yeah.
And they obviously got along very well. I would expect that they shared everything.
So did you give her a fixed set of teeth?
Yeah, absolutely.
Pull it off?
And nowadays that we can do that. We have very, very good ways of provisionalizing, we call it, or temporary type teeth. But they're never going to be without their teeth. And it's absolutely exciting when you can provide that care. When they come back to you, they're some of my best, happiest patients.
Why is it, by the way, doing research about dental implants, what used to take you guys 9 months or so to finish something now can happen in a few visits?
I think,
what's changed?
I think a lot of it is technology's improved.
Okay.
We have, for instance, in my office, I have a 3D cone beam CT scanner. Big words for, essentially, it's an X-ray machine that will give me a 3-dimensional representation of the jaw bones. So we're not guessing. We're not going in at the time of surgery and realizing there isn't enough bone that we need to fix or repair.
So you know ahead of time?
Yeah, we know ahead of time. We know that the implants have improved. We know that the surfaces are accepting the bone much faster. And we know that with all of the trial and error, what will work and what doesn't work. So we're having.
So it's very predictable, very predictable
procedure.
Extremely
predictable, yeah.
And what are the age ranges of people that can qualify?
Yeah, that's a great question because I get that all the time. I'll have someone who comes in with a busted tooth, and they're younger. What we find is that it ranges from typically 16 years old and a girl, all the way up to we've had them in their 80s and 90s. Typically,
is that right? A 90-year-old getting dental implants?
Oh yeah, absolutely.
Why would they want to get dental implants?
Yeah,
at 90.
well, they need to eat. they need to chew. You know.
All right.
Yeah. So and they want fixed teeth. They want to feel whole again. They want to feel solid, where they snap these teeth in, or they're put in permanently, where either the dentist or myself can remove them.
You know, when I looked on the internet, I think like 25 million Americans either have an upper or lower denture, depending on what you look at. And so in Illinois, there's got to be tens of thousands, 100,000 maybe, people that have an upper or lower denture.
No doubt, no doubt.
If it's so good that with only 2 implants or 4 implants to give them a full set of teeth, why isn't everybody doing it? What's your take on that?
Well, what we find with denture wearers is that they don't go to the dentist anymore.
Okay.
You know?
Okay,
and
good point.
so they're not being educated by their general dentist as to what the possibilities are. You know, many of them, nowadays are self-diagnosing. You know, and they think that they're not even a candidate.
They're too old.
Yeah, that they're too old. They don't have the bone quality.
My
that
mother
type
at
of thing.
73 years old said, Randy, because I told her about dental implants.
Yeah.
And she says, my medical doctor said at 73 I'm too old.
Yeah.
They'll fall out.
Yeah.
Does
And
that go on?
Absolutely, and it's a belief. You know, they believe that that's kind of the part of the aging process, when we know that's not it at all. You know, and then it comes down to fear. You know, it's a normal human thing to be afraid of things. You know, they've had a lot of dentistry in the past, and some of them are older, so maybe it didn't go so well back in the day. You know, there were some dentists back then that didn't use anesthetics. We certainly provide anesthesia, and we provide this as a painless
So they're
care.
afraid of the dentist, a lot
Yeah.
of these denture wearers.
Yeah, absolutely. And they're some of my better patients, the ones that have had success with the implants, have gone through this as far as recruiting the other patients that are suffering. I really feel for the denture wearers. It's just it's not an acceptable alternative any longer.
So let's move on to the categories. So what are the categories of dental implant patients that you see?
Well, we have those that have a single tooth missing.
Okay.
We have several teeth, 3, 4 missing, and then we have those that have no teeth at all.
All right.
So there's definitely different categories. You know, I work with patients in all different areas.
So why? So give me help me understand this. Okay. So traditional dentistry, if you're missing one tooth, what's the advantage with getting a dental implant over however they fix? You know.
Yeah, I spend quite a fair amount of time educating patients about their options.
Okay.
And you know, some of them are torn. You know, because they think that a traditional bridge, which is where we take the tooth on either side of a space and we drill those down, make them smaller, and then put 3 teeth in for a 1-tooth problem.
Okay.
They think that is a very traditional approach, but we educate them as this is a 1-tooth problem with a 1-tooth solution. So if we have one missing tooth, we'd like to replace it with a dental
Does it
implant.
last longer than a bridge or partial or whatever you're doing?
Yeah, that's an excellent
statistically?
question. Yeah, statistically speaking, we know that bridge work lasts about 7 to 10 years. And for various reasons, those teeth that are holding the bridge have problems.
So it's probably less expensive than in the long run
I think, you know, we've run these numbers many times, you know, to try and help patients understand this. And yes, when you amortize out the lack of going to the dentist for a dental implant, the lack of decay, the lack of root canals, the lack of breakage, and the peace of mind and the reassurance that they have something there that is solid.
Okay.
You know, the investment is well worth the dental implant.
Now, what if somebody has bad gums? For those that they've been told their teeth have to go, the diagnosis is those teeth can't save them anymore.
Yeah.
What if their gums are too bad? Could they still get dental implants?
Yeah, I think if it's pretty clear cut and the teeth have to go, this is a treatment plan, yes. Once we remove the teeth, things will heal up, the gums become healthier, and then, of course, we still do our diagnostics.
So the infection goes away?
The infection goes
Okay.
away, and yes, they're candidates for dental implants.
And their breath gets better? And
There's no question, yeah. I mean, there's a lot of things that get better. When a patient has been struggling and dealing with gum disease and their teeth are removed, their life just improves. And then we make it even better with doing
now, we should mention, and I like this about you because off camera, your job is to save teeth. I mean, you love to save teeth.
Yes.
But some patients, I don't want to put words in your mouth,
Yeah.
hold on to their teeth too long.
Yeah, I think
that true?
Yeah, well, you know, there's that emotional component. You know, they're hanging on. It's a part of their anatomy.
But
part of
ideally, for a
themselves.
tooth that has to go, remove it, put it in a dental implant. It's like getting your teeth back.
Yeah, and I think
I don't want to be
that's
oversimplifying it, but,
yeah,
but is that the truth?
It's
is
an
there
excellent,
truth in that?
Yes, there's a lot of truth to that, and it's an excellent alternative. You know, a tooth is a biologic thing. You know, it takes on bacteria and holds it. A dental implant doesn't. It's a different type of thing.
Okay.
You know, and it's a much, in my opinion, in some patients, when their teeth are, the gums are infected, and we remove their teeth, they get better.
Beautiful, healthy gums.
Yes.
Okay, good. So moving on to the topic, which is no more dentures. I mean, according to you, you say that you can get a fixed set of teeth, a permanent set of teeth, and maybe just a few appointments.
Yeah.
So you brought these models. What are they?
Yeah.
Do you show these to patients?
Yeah. What I wanted to bring with you and show you is how I educate the patients here. Essentially, what we have here is a full denture. So the upper denture, because it covers the roof of the mouth, it holds on like a suction cup. So it stays in there pretty well. But what we find is with the lower denture is that the patients have trouble holding that in. So our solution to that, which is very unique, is to actually take a denture and place a couple of implants.
So 2 implants like right there?
2 implants right in there. Very safe. We're not dealing with some anatomical issues. Very safe and very predictable. And then the patients are able to snap that in there. So why don't you take that, take a look at that and see what you can do.
So this is snapped in.
Snapped in.
So it's
and
not
so
an
you feel how rigid that is?
Very nice.
I mean, it's
so
like,
right underneath here, if the camera can pick up. So
yeah. So you have a couple of little locators, we call them.
All right.
And they snap in just
so
like
no more
that.
adhesive?
No more adhesive. Absolutely.
I mean, what could they eat with that, for example,
they can eat,
option?
Yeah, with this option, I've actually had patients that are eating apples.
Okay.
Yeah, I mean, think about that. We take that for granted. They cannot even bite into an apple because these things are falling apart.
If there was, we talked on the phone about this, and I think you said that if there was a try-in period, okay, so in your town, I mean, there's got to be thousands of people with an upper or lower denture, that if there was a try-in period, like, hey, come in on a Friday, try 2 dental implants, that they couldn't go back to their loose-fitting denture.
Oh, there's no way. There's
really?
no way they
You're
would
convinced
go
of
back.
that?
No, there's no doubt, Randy. Yeah, absolutely.
Really?
To have something like this that's falling out of their mouth, I mean, and then they're being able to snap this in, there's no going back.
So when we say at the top of the show, no more dentures, I mean, the future of dentistry, I want to make sure I have this right, is that all dentures will be secured probably by something, like a couple of dental implants.
Absolutely. And what I find with this is a very common, it's kind of a delightful complaint, if you will.
Okay.
Is the patients will tell me that, hey, my upper denture, you made it loose. And I say, wait, what do you mean I made it loose? I put in dental implants and made your lower denture stronger. I said, because you're chewing against something that's very rigid, you feel as though the upper is loose now.
Oh, interesting.
So now
the contrast now all of a sudden they thought that their upper was fine.
Absolutely. But now because it's so rigid and they're chewing against this, very, very rigid denture on the lower, the upper feels loose.
So 2 implants, you get a full arch of teeth.
You can do that absolutely.
Now, how soon could they start? I mean, in a perfect scenario, okay, 65, 70-year-old, fairly healthy,
right.
Comes in. How soon from beginning to end can this happen?
Well,
somebody watching this.
Yeah, my comfort level with this is to actually I can take teeth out, place dental implants, and within about 6 to 8 weeks, we can actually have them snapping their teeth in.
Is that right?
Absolutely.
But they're never left without teeth,
No,
right?
no. We would have a cushioning, soft lining denture over
But it's got to be painful, though. Implants
yeah,
I
still wrestle with that. Intuitively, it just doesn't seem to make sense. You're putting this anchor into the bone. But quite honestly, it doesn't hurt. And I hear this time and time again. In fact, I almost say it kind of smirking, this isn't going to be very difficult at all for you. And the patients come back 100% of the time and will tell me, and I'm not kidding, 100% of the time they will say this was easier than I thought it would ever be.
Yeah, my father, we talked, recently got dental implants, and he got the 2 on the bottom, snap in, snap out. He said, Randy, I was petrified. He didn't admit this to me until it was done.
Yeah.
And he said, it didn't hurt.
Yeah.
So that's something you hear, is that right?
Absolutely. Yeah, this is where I really enjoy what I do. We usually will prepare the patient for, telling them that this is going to be more of an ordeal, and it's not. They will tell me time and time again. I took one ibuprofen, doc, the night of the procedure, and I didn't have to take anything more.
Oh, really?
And I find that time and time again. It's fascinating to me too.
So fear of pain is the #1 reason why everybody's not doing this?
I think it's the largest demotivator, if you will, why patients don't proceed with this. Yeah.
And they think they're too old. And you say 80 and 90-year-olds are getting dental
There's no
implants.
question. The big thing is just as if you have your health, and many of the patients are on multiple medications. That's another point.
But it surprises me that a 90-year-old would be a candidate
Well,
for something like this?
Yeah, if the bone quality is there, and in fact we have smaller implants, you know, called the mini implants, many of us are using now too, smaller with thinner bone. But some patients, quite honestly, don't even have a choice, in my opinion, because they're on multiple medications. They have dry mouth, and this makes the wearing of the denture very, very uncomfortable.
Interesting.
You don't have the saliva output, which typically is acting as a stickiness to the denture and the soft tissue. So they really don't have an option other than they must, in my opinion, proceed with dental implants so that the denture is not rubbing on those dry tissues.
Okay, good. Okay, so 2 implants.
Yes.
For the denture wear, what's the next step up?
The 2 implants kind of get you started, if you will. You know, it gives you the retention, gives you the ability to hold that denture in. But if you really want to knock it out of the park, you're going to go ahead.
Knock it out of the park.
Yeah, you're going to put those other implants in there because it's going to give you much
like how many? How many more?
Well, I would say at least 2 more.
Okay,
you know,
so
you have 4 implants, and it's
snap in, snap out.
You can do the snap in, snap out, again, depending on the anatomy. If we want to go into something where you're not removing it, we need to at least have 6 implants.
Okay.
3 and 3. And then I can give you the absolute certainty that you're going to have something that feels like a natural set of
But
teeth.
isn't that what everybody wants, by the way? A fixed set of teeth? They don't have to take them out?
Yeah, I think that's what we all want, you know. Some of the limitations are on the anatomy. We may have some difficulties there, but most people will qualify for the bare minimum of those 2 implants. We can get those to snap in. They're feeling secure again. They're able to talk and laugh and smile. You know, it really is a life changer.
Now, by the way, you know, going into this interview, you know, and I was telling my staff, I said, oh, brother, you know, dental implants, and you think it's an exciting topic, but you say you're changing people's lives.
Oh, without a doubt. It's one of the most miraculous things that I feel, you know, within my control. I'm able to help people so dramatically. I mean, think about it. You know, if you're able to go ahead and socialize again, you know, you're not having to worry about if your teeth are moving around or if you have, you know, issues with chewing. You know, these people have difficulty because they can't even go out to dinner or to lunch with their friends.
Do they tell you that? Do they tell you that?
Absolutely, yeah. I had a gal the other day. She said, you know, I haven't gone out in years. Now that I have my dental implants, I'm able to spend time with my girlfriends again. I'm able to get together with them and go out to lunch. And I used to have to run to the washroom, you know, and worry about is there food caught under these dentures.
So they could eat broccoli and carrots. I mean,
yeah, and
seniors are all told to have fiber.
Yeah.
But I guess if you have a denture, you can't really chew it very well.
Yeah, well, you know, most unfortunately have had to revert to drinking fiber, you know, and now they can actually get it through a healthy diet because they're truly chewing again. They're masticating, we call it. You know, they're feeling the textures of the foods now. You know, when we can get rid of the palate, they can feel that. They can taste better. You know.
So every denture wearer, if they knew the benefits, would do it.
Without a doubt. Without
Really?
a doubt. Absolutely. 100% convinced.
And it's just the fear of the dentist, thinking they're too old, things like that are keeping them from doing it.
And I think and cost becomes an issue too.
Because they count their teeth, you think, and they think, I mean, 2 implants, they could have something that's
and I think that
in.
they look at, you know, we get that question all the time, what do you charge for a dental implant? And then we get the fee, and then they start multiplying by how many teeth that they have missing, and it seems to be quite a bit. But what they really don't understand is that they don't need.
They could just have 2 implants.
They could have 2 and take care of the whole project. And, you know, nowadays things are so much more affordable, you know.
Has it become mainstream? I mean, dental implants, I mean, across the country are becoming, and you're teaching other doctors, so everybody's learning how to do this?
Yeah, in fact, you know, what we're seeing is more and more general dentists that are doing dental implants.
Does it cost more to go to a specialist? I mean, you're a specialist, periodontist.
Not typically. I think, you know, my opinion is that I would rather, you know, go to someone who does this on a regular basis. This is something I do all day long. You know, I have multiple cases a week. So usually what you find is that you want to go to someone who does something more regularly, and then you'll have typically less problems.
You know, I'm not trying to endorse you, by the way. You know, people visit our website, wellnesshour.com, and it's not an endorsement site.
No,
I mean, I'm interviewing you. This is a real interview.
Yeah.
But people do ask me, who should I see for this? Who should I see for that? I say, go to a specialist.
That's right.
But you're saying it doesn't cost more to go to a specialist?
No, not when, you know, you look
So why not go to a specialist, I guess, is my question.
Yeah, well,
right?
I would always say go to the specialist, you know, and you're always entitled to get an opinion. And I would
Can they go
anyone
to you directly? I mean, they could go to you directly.
Absolutely, they can come to me directly.
Because you'll work with their dentist, right?
Yes, I do work with their dentist. Primarily, that's what my practice is built on, is the referrals. But as this becomes more and more, prevalent, I have a lot of patients that seek me out just individually.
And you're big on the patient experience there.
Yeah, without a doubt. I mean, I think that that's the thing that we've all had to endure at one point in time or another, is a difficult experience in having any type of dental procedure. All the way from the beginning of how they're greeted on the phone to how they're greeted when they come to the office. We want that to be a very, very good experience.
Do people say this is a different kind of a dental office than I've ever been to? Do you ever hear that?
It's surprising to me how much I hear that now.
Really?
Yeah, I knew that was my goal in the design of the office and providing, the warm colors, the comfortable chairs, the lighting, all of that type of thing. I didn't realize how much of a factor it really was. It's a joy to know that we've put that much effort into something and thinking and caring about our patients, and then to hear positive, kind words about it.
Now we are out of time, but the smile, we haven't talked about the importance of a smile.
Yeah.
You say it's more than just dental implants.
Oh,
elaborate.
There's so much more to it, and I brought some photos here I'd like to share with you, if you wouldn't mind. Of this fella here, when we look at his smile, or lack of, I should say, you really can tell. He was 84 years old, came to me, and he was just miserable because he had some bridge work that he'd been dealing with. He had to clean under it. He got a lot of food under it all the time. He said to me, "Doc, I've got some bad breath here." And then finally, this bridge just failed. It came out, and he really was left with this particular, the way he looked here. Yeah, not great. And so he needed to do something pretty quick. And so the solution was the dental implants, and he actually opted to go with 7 implants in this case here. What he wanted to do was to be able to clean between his teeth.
Like flossing?
Flossing, absolutely. So he wanted that, and that's why we did that. Certainly we could have done fewer implants.
So he ended up getting a fixed set of teeth.
He got a fixed set of teeth, replacing what he had lost.
Let's take a look at the after.
Years.
Let's take a look at that.
And I'm delighted to show you this. If you could take a look at that.
He looks very happy there,
isn't
by the
that
way.
amazing?
I mean, 80 years old. The guy looks great.
Yeah, 84.
84.
Yeah,
84 years old.
I want to make sure, that he is happy as a lark. He's you see it in his face. You can feel it.
He looks like a different guy. I mean, he definitely looks a lot
younger. Doesn't he look
younger.
different? I know. It fascinates me at how much of a difference. This is a easy makeover.
Now, is this one of those things where he says, "Doctor, I should have done this years ago"?
Yeah, another kind of a canned statement almost. I hear it time and time again, and it's enjoyable to hear that. You want that. I look for that experience. I really do. It's so nice to hear them saying that, but you almost wish you could have impacted them earlier.
Now, for the people, because I mean, you get a very successful group of people, but you get regular folks that come in, because I guess a lot of people wear dentures. Would you say there's thousands of people in your town?
Yeah, I'd say that now that I've been doing a lot of implants, we're getting less, but of course there's thousands of people in the
and they just don't know their options, in your opinion.
I think that they don't know their options. I think that they're looking at something that's less. They're not looking for the end all be all. Sometimes they're not aware of how easy it is.
2 implants. Now, for the people that are really afraid of the dentist, right?
Yes.
You are a specialist with IV sedation.
Yes.
Tell me about that. We are just about out of time.
IV sedation, safe and effective. I find that this is much better than oral sedation, which is a little less predictable.
A pill, okay.
Yeah, some will say taking a pill, but it's not as predictable as having the ability to regulate the medication. Very safe, very effective. If for some reason the patient were to have an untoward event, meaning that they didn't, weren't doing well, we can reverse that medication.
You can pull them out of it.
We can pull them out
pill, you
rapidly. You can't, because you have no access.
So
it's much safer.
did these people don't even remember the situation?
They don't remember the situation at all, and that's fine. Dentistry for some people is just a very, very delicate area. They've had some bad experiences.
That is an advantage, by the way, to going, because I'm thinking here about going to a specialist, right? Mm-hmm. That the specialist, I mean, you're trained in IV sedation.
Yeah.
Are all periodontists trained in that?
Not all periodontists are trained. It was something that I had chose to do because I know how difficult this is for a small segment of
Do you do it on half of the people that come in?
I would say that maybe half. I never really looked at it. I just know that it's in my armamentarium, if you will, of being able to make it a very good experience for the patient. I want to have that if they ask. Some have had it in the past, and that's what they're used to, so we want to make sure that we're doing their dentistry safe and effectively.
Now this guy, do you find that the patients, okay, so they have these dentures, you give them dental implants, a fixed set of teeth, or snap in, snap out, they act differently? They become more social?
Oh, there's no question. They become more social. They are able to eat better, so you start to see that they become healthier. I've actually seen patients lose weight. You know, you would think that what I've actually seen with when they have full dentures without implants is that they actually gain weight because they cannot eat properly. They're eating higher calorie foods, softer foods. You know, these are the people that go to McDonald's and eat this. I probably shouldn't say that, but I will tell you, it's not a very healthy diet with traditional dentures. When we have them fixed, they're able to start to chew rigid food.
Did they ever come in and say, "Doctor, I have goals. I just want to eat a nice juicy steak"? I mean, do you ever hear that kind of stuff?
I do hear that. Usually, you know, the men are more about the function, you know.
More about eating.
More about eating the steak, yeah. But I do have the women occasionally.
So what are the women? I mean, what's their goal? Just no more dentures.
Well, they want to make sure that they have something that supports, you know, their lip, giving them cosmetic, you know, benefit. You know, with a traditional denture, it doesn't always give that type of support because it's not holding on. It's just sitting on the gum tissue, kind of floating around in the mouth. So yeah, there's different desires, but the end result is that we give them something that is very predictable, relatively painless, and very quick nowadays with our treatment modalities.
Okay, good. So we're out of time. Somebody watching this, they have a denture,
yes.
Or their loved one has an upper or lower denture. What do you tell them? Where do they begin?
Yeah, I would say that you really should, you know, look at what's going on, kind of watch their lifestyle. You can see they become more sedentary even. They become more reclusive when you see they're not socializing as much. And we need to get them into my office. We need to get them.
Come in for a consult.
Come in for a consultation. We'll take a look at them. We'll see. You'll see what they've been
suffering with. And we'll give you
with.
this interview for your website.
Well,
maybe they should force their loved one to watch.
I think
this
so.
Interview.
I think so. I would be very, very happy if they did. Many more people would get out of that silent suffering.
All right, all right. Well, thank you so much for coming to the show.
Very
Interesting
nice.
stuff.
Thank you.
Good stuff.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. You could put in Dr. Denemark, or you could put in, you could just put in Illinois dental implants. He'll show up there. For now, I wish you good health.